Hello.
Okay. Hello, participants. Good afternoon. I hope you all have relaxed adequately and you're ready for the sessions today. We are just tying up a few loose ends. In a few minutes, we will be with you.
Yes, I could hear you, Dr. Lakshmi Prabha. Thank you.
Okay, Ms. Ramni. I welcome you all, dear participants, to the second day of our two-day webinar on the impact of COVID-19 on lifestyles, quality of life, and coping strategies. I hope you all enjoyed listening to our learned resource persons yesterday. We shall begin today's sessions with a prayer.
Make us instruments of your peace. Where there is hatred, let your love breathe. Lord, make us instruments of your peace. Walls of pride and prejudice shall cease. When beyond your instruments of peace.
That was the college prayer rendered by our college choir. The first session today is on the impact of COVID-19 on different sectors of the economy. As all of us are aware, COVID-19 has severely impacted all the segments of world economy, be it the production, manufacturing, hospitality, entertainment, education, agriculture, textiles, transport, and so on, resulting in losses to the tunes of lakhs of crores of rupees. It has also thrown light on the inadequacies in our health and preventive healthcare infrastructure to cope with a pandemic of this magnitude. I would not be exaggerating if I say that leaders of all nations worldwide are literally at their wits' end to combat the pandemic and to revive the economy to ensure a sustainable tomorrow for humankind. It is indeed a huge challenge. To address the session, it's our good fortune that we have a leading woman entrepreneur, a visionary industrialist, and a role model to many budding entrepreneurs, Mrs. Suchitra Ella, co-founder and joint managing director of Bharat Biotech International, Hyderabad, Telangana. The firm has been playing a very prominent role in the success story in the pharma sector in our country and elsewhere. Bharat Biotech is also actively involved and is a front runner in producing a vaccine for COVID-19. I do not want to take more of your time. I hand over to Ms. Ramani Dhanraj, Head of the Department of Office Management, to introduce Mrs. Suchitra Ella. Over to Ms. Ramani Dhanraj.
Good afternoon, Mrs. Suchitra Ella and dear participants. I am Ms. Ramani Dhanraj, Head of the Department of Office Management and member of IQAC. Feel privileged to introduce a very dynamic, enterprising, and successful woman entrepreneur, Mrs. Suchitra K. Ella, co-founder and joint managing director of Bharat Biotech International Limited, Hyderabad, Telangana. Bharat Biotech is a leading innovation-driven manufacturing company globally with over 110 global patents, 1,700 employees, with exports to over 100 countries and more than 4.0 billion doses of vaccines supplied to public health worldwide. What an impressive statistics that is. Mrs. Ella graduated from the University of Madras in economics and philosophy before moving to the US in 1986, where she further specialized in business and marketing operations at UWCU, Wisconsin. Her strong interests in marketing and business, working full-time and studying part-time at Madison WI, and a postgraduate diploma in patent law from Nalsar, Hyderabad, led her to partner the very pioneering Bharat Biotech with her husband. As a joint managing director of Bharat Biotech, her vision, dedication, and hard work, leadership and organizational acumen have helped in fostering a sustainable growth path for the company. Her divergent thinking with a new vision and outlook has helped in shaping the challenging yet path-breaking efforts, making Bharat Biotech stand out in a short span of 24 years. Mrs. Suchitra effectively manages multiple roles in various professional and non-profit organizations in varied higher leadership roles like CII, IWN, TTD, ISB, UWI, to name just a few. Mrs. Suchitra has co-founded two non-profit organizations, Ella Foundation and Suchitra Ella Foundation, Krishna and Suchitra Ella Foundation. Her progressive outlook towards social causes and many other impressive causes, including passion for girls' education, has made her a recipient of many awards like the South Indian Business Achievers Award, SEMA Singapore 2016, AP Entrepreneurship Award, Narsarapet Guntur 2015, ZTV Best Entrepreneur Award, Hyderabad 2011, to name just a few. Indeed, St. Joseph's College and Institution, which has empowered and scripted success stories for lakhs of women across the globe, feels privileged to host a session by a very dynamic and successful industry leader who is basically a woman. Thank you, ma'am, for accepting our invitation to speak as the resource person in our webinar, in spite of your busy professional engagements. Without much ado, I now invite Mrs. Suchitra Ella, co-founder and managing director of Bharat Biotech International, to share her knowledge with us. Over to Mrs. Suchitra.
Dear participants, there is a small technical snag and we may take a few minutes to connect to Mrs. Suchitra Ella. So these are the challenges that we have in front of us. It is being thought from newspapers, as we hear, by the government, that we may have to go in for a mode of blended learning, where we may have online and offline teaching. So when we are faced with challenges like these, it makes us realize that there is more than what meets the eye. Because as per a survey which has been conducted, more than 71 nations where less than half of the people have access to the internet. So we need to wonder as to how we would be able to face this challenge and be able to deliver the goods, especially in the education sector. So please bear with us and let's wait for a few more moments before Mrs. Suchitra joins us. Thank you.
We will just turn on the audio, but I think we'll have a few challenges today. The speaker is also, connecting, disconnecting. We'll wait for that. And we also have a lot of rain in Visakhapatnam. So looks like we will go in for a few technical issues. So let's be patient. Technology is something that all of us have to manage. Let's be a little patient. Let's wait for the speaker to host.
Dear participants, we are in touch with Mrs. Suchitra and her team. She is right now very busily preoccupied with a small issue that has cropped up. So she will join us in a few minutes. As Ms. Ramani Dhanraj has introduced Mrs. Suchitra, she is a very busy business person. And since their firm is, since the organization Bharat Biotech International is currently deeply involved in the research pertaining to development and production of a vaccine to fight COVID-19, we can understand how busy they would be, and we would not be able to understand actually and imagine also the number of issues that could crop up on a day-to-day basis. So being in the decision-making chair, she must be very busy and preoccupied. So let us be a little more patient and wait for Madam to join us. I am sorry that we are making you wait, but we need to understand that when we have a resource person like Mrs. Suchitra Ella going to address us, we need to understand the situation and the demands of the person. So I request you to please wait for a few more moments before Madam joins us.
Suchitra anne Suchitra button. Suchitra Suchitra madam join ayara. Madam share screen ichim pedamani cheppandi madam maatladamani mikta same process. It's an seriously it's an
షేర్ స్క్రీన్ ఇచ్చాము మీరు ఒకసారి చూడండి స్క్రీన్ మీద షేర్ స్క్రీన్ ఆప్షన్ వస్తుంది
it's an madam
వాళ్ళు చేయాలి కదా
co-host madam
మీరు కో హోస్ట్ చేయాలి చూడండి శ్రీనివాస్ మాట్లాడు
మేడం అక్కడ మీకు స్క్రీన్ మీద షేర్ స్క్రీన్ అనే గ్రీన్ కలర్ లో కనిపిస్తుంది సార్
Hello? Hello? Hello?
Ma'am, good afternoon, ma'am.
Hi, hello.
Good afternoon, ma'am.
Good afternoon. I'm Suchitra here.
Yes, ma'am. Now,
Am I visible to you?
yes, ma'am.
Okay.
You are,
And
Madam,
I'm
you are
audible.
visible and we are able to hear you also.
Oh, great, great. I'm Suchitra here.
Yes, we are just waiting for you, ma'am. All the participants are waiting for you. We have
Sure.
read out the introduction already.
Okay.
We are anxiously waiting to hear you.
Sure, sure.
I am Lakshmi Prabha, head of the Department of Home Science.
Okay.
It's a pleasure to see you and hear you, madam. So please go ahead and address our participants.
It's absolutely a pleasure to be meeting you, though not in person, but in this way.
Yes.
And I'm very happy that I have known LVS for quite some time now, and a very good human being that I appreciate and I have seen in him. And
Thank
when
you.
he asked me for this, I said, yes, I will definitely try and get back to them. And
Thank you so much, madam.
thank you for giving me this opportunity. I love connecting to students, and I will do my best. For
The
my
audience consists of faculty from all over the country. We have about 1,000 participants.
Oh, wow.
And yes, and the participants are from varied backgrounds, madam, academic backgrounds. We have
Okay.
people from sciences, from home science, from commerce, management studies, and we have a few people from the industrial sector also. We have some from the pharma also.
Wonderful.
We have quite a few enthusiastic participants waiting to hear you.
Okay.
I hand over the session to you, madam. Please address the participants.
Okay.
Thank you.
Thank you.
Please start, madam.
Good afternoon to all of you. I hope I'm audible and visible.
Yes, madam, you are audible and visible also. Yes.
Okay, thank you so much. A very good afternoon to all the participants of this program at St. Joseph's, Visakhapatnam. I'm very thankful to the faculty and the organizers, the team, especially who have thought through this kind of sessions. Which are very apt and meaningful also at a time when we are all in getting used to different normalcies of life and changes in the normal life or routines that we have all been facing for the last 2.5 months. Having said that, I would like to start my discussion today with all of you. I hear that there is a mixed audience. I initially thought it was students, but it does not matter. And I'm just going to speak about a little bit of my background so that in order to give you all an introduction as to what kind of a work background that I come from, so that it will maybe better enable you all to understand and hopefully relate to one or two things that I would be saying, and it would probably make some sense. Having said that, I am a first generation entrepreneur. I would like to start off with that because I'm very quite happy, and in fact I would say I'm very proud of saying that also, because I'm a first generation entrepreneur. Moved back from the United States during the years 1996-98 along with my husband and family, my children, and we took a conscious decision to come back to India, to relocate and become entrepreneurs. To start with, that too in a sector which is highly connected to knowledge, scientific research, academic research, a lot of teaching, a lot of learning, and also a lot of processes and products which are connected with biotechnology in the life sciences sector. Because essentially our backgrounds are from that. Dr. Ella, the chairman of the company, is a PhD and has been a faculty in universities in the United States. So the core competence for us was to be in the technology space pertaining to life sciences. So when we thought about this, our first and foremost thought process was to think of bringing about technologies or products that were not available in India at that point of time, because this is late 1990s I'm talking about, close to 2000, in fact. So we primarily looked upon how we could, as young entrepreneurs, though not knowing a lot of business and all the other aspects of being in business, but with technology and with a vision to create indigenous platforms and products that would be available at much cost-effective means to the public at large in India. So this was our primary thought process, to make products in India, not to buy it from somewhere and assemble it here or put it together here and then do marketing. Rather, we wanted to do it from scratch. So the research component was very important for us because, as I said earlier, it is a life sciences sector. Pharma, biotechnology, medical equipment, testing equipment, kits, reagents, a lot of aspects which are connected to the pharmaceutical industry at large, but more specifically tuned to the biological processes and the biological areas of work that we wanted to focus on. And we chose to work on vaccines because we found that very kind of not still there in terms of what was happening in the West at that point of time. We had government labs which were pursuing first generation vaccines. So which was, I would not call them outdated, but yes, they were slowly getting outdated. And there was a need for new technology, the next generation to come in terms of the technology, which would also enhance the quality of the product. It would make it available in larger quantities, because as a population, the country also needed a very large number of doses in terms of the vaccines. So the second generation of technologies, which involved more of biotechnology, the route that we had to take was primary for that, was very important for that. And this also gave us a high quality products and a large volume of the product. And also thereby we could bring about an extensive reduction in the pricing of these vaccines when it was made available to the public and to the common man. So this is how our journey began. This goes back, like I said, in 97 and 98. We started a little bit of the upstream work for the hepatitis B recombinant protein vaccine was already done in the US. And we brought that technology here and then started adapting it in the processes that are required in order to make it in larger volumes, and also had to build the facilities for it, because we cannot make vaccines and drugs or pharmaceuticals in laboratory scale because the governments, they are highly regulated products. Vaccines are highly regulated products. So as any other drugs, as you are all aware. And hence, it was very important that we have to also establish what we call the manufacturing facilities, which have to be capable of handling 10, 20, or 50 million doses of these products that we are talking about. So the facilities were built in Hyderabad. We are located right now off of Hyderabad, about 40-50 kilometers outside the city. And today it is called the Genome Valley of India. It is also the largest cluster of the biotechnology based companies and R&D laboratories and other companies which do a lot of work in the biotech space. So this is by far one of the largest clusters, the largest in India and one of the largest in the Asian continent as well. So that's how our journey began, with one vaccine, which was hepatitis B, which was made for both adults and for children primarily, because children needed, all of us need 3 doses. And for children, it was very important because the hepatitis B infection was later on, detrimental for in the life cycle of a child. So we developed it for both children and for adults as we moved along. That is then. Hence, 20 years later, almost more than 20 years later, bringing it to the current time frame after 2000, after 20, in the last 15, 20 years or so, what we have moved on to do is to do a lot of other products. We researched and have brought about multiple vaccines for many of the infectious diseases that we as a country and as a developing country are dealing with in our own states and in our own regions. And apart from that, not only that, we also wanted to see whether these could be then exported once we have taken care of the requirement of our country internally. Then we were also looking at how we could make these vaccines available to those countries that also are like ours in many ways, which needed good products, but at very, very affordable costs and with international quality. So that's how we then started looking at many other vaccines. I would think of polio. I could talk, these are a few products that I just want to bring it to your attention so that you can understand the background again. I can mention the rabies vaccine, the anti-rabies vaccine, which is given for dog bites, which is a very, very difficult infection to handle. And if it is not attended in time, then the person who is bitten by the rabid dog, almost its death is an eventuality within a matter of weeks. So this is a very serious infection, very difficult to be dealing with even in a hospital situation, and there is no correction or bringing the person back to a normalcy unless giving the vaccine. We also developed combination vaccines. We developed rotavirus vaccine, again for the first time in the country. We were the first company to make it and also deliver to the country, and also became the third company in the world to have a vaccine for rotavirus infection, which is again primarily in children under the age of 2 years who develop diarrhea and acute diarrhea, which leads to dehydration. And then it also, in many cases, it leads to death of this child under 2, because primarily most of these children are from a rural background and they do not have access to quality healthcare or immediate attention. So after a week or so of acute diarrhea and dehydration, if the child is not attended medically in a proper medical environment, then the child dies due to this infection. This is called rotavirus. So this again leads to almost more than 1 lakh children dying in India alone, even to this day, So it is a very huge number because we have a very huge birth cohort in this country. When I say cohort, it is the number of children being born in India each year. It's an extremely big number. 25 million children are born in India. And it is important that many of these children do not have access to these kinds of life-saving vaccines. So this is what prompted us to get into that area of work. And we did that very successfully in 2015. Having said that, we also have launched vaccines for typhoid, which is very effective in curing typhoid for both infants and for adults up to 65 to 70 years age. So typhoid is a vaccine which is given to both children and adults, just like hepatitis B or rabies for that matter. After which, in the last 10 years, when the last time we had a pandemic kind of a scenario, those of you who are in college now probably may not remember this. In 2010, we had an issue, we had a pandemic scenario, which was again called the H1N1 virus, which was very rapidly prevalent and had also started contaminating in India. We started having infections in India. There were other countries in the world which had this impact as well. So the countries in the world again had to have a vaccine to encounter the H1N1, which is also commonly called as swine flu. So for those of you who are not in the sciences, you could just maybe, when you have the time, you could Google it and you can read about it more. So we were one of the companies at that point of time to have made swine flu vaccine. Again, at that time, the government of India had made it as a requirement and also wanted it to be ready if and when it would become a larger pandemic or a larger issue to deal with as a country, and in order to effectively safeguard and protect the population of the country. So this is how our experience has been in the last 25 years since we started out in this particular area of work. We deal with a lot of medical technologies, and we collaborate with universities and research institutions, both in India and in the rest of the world, because scientific knowledge and scientific research, academic research happens all over the world, and there are several groups, several institutions worldwide who work on many of these public health scenarios or infections or new disease burdens that we as a world are of late witnessing. We work on different vaccines, so I don't want to get into the technical aspects of all those vaccines, but I'm going to come into the situation with where we are right now in COVID. This is, again, COVID is a cousin or belongs to the family of viruses, which also, again, was prevalent about 8-9 years ago, roughly in that time frame, just after 2010. And at that time, we called it the SARS virus. And it exactly created almost the same symptoms when it started infecting humans. And it also then traveled from the Asian countries to the Western countries like Canada, Europe, etc. So there has been a precursor because SARS came in the first half of 2010. So there was a precursor to this now, but maybe it did not rampantly scale up in the manner in which it has done this time around. And it has shaken the whole world almost, I would say that. And it has taken everybody by surprise, by shock rather, because no country in the world was prepared for it. China was the first country where it started contaminating from going by whatever we are reading in the available form of authentic information through authentic agencies that look at public health worldwide. They say that the origin of this could be from the bats, and then the virus mutated or latched on to another system, they think that it went to the pangolins, which is a small animal, and then from that model, the virus again has adapted itself or mutated itself and latched on to an ACE2 inhibitor, which is present in the human lungs. So this is by far the best possible place where this virus wants to go and attach itself to. That is why today, when we hear about COVID or the cases or when the contamination and the infection happens, that almost all the patients have to deal with acute respiratory distress, pulmonological distress or malfunctioning of their lungs, and the virus then multiplies. If say maybe one virus latches on, enters into the nasal tract through our nose and through our eyes, then it goes into the nasal tract and goes into the lungs, and the lungs become its breeding ground. So one virus then multiplies into maybe millions of viruses inside, the cells multiply, and then it completely chokes the lung, fills up the lung capacity, and then it starts arresting the functioning of the lungs, which is what then causes the respiratory distress, because the patient at that point of time is then having difficulty in normal breathing, and the intake of oxygen suffers, and then this leads into complications, and then the patient then requires uh, external support as a ventilator, or oxygen is then provided, or then the serious cases, the ventilator has to be brought in order to keep the lungs functioning, in order to sustain that person's life. This is how this virus has now affected almost millions of people around the world, across the world, the biggest of the largest of the countries, the richest countries, and the poorest of the countries, the smallest of the countries. It did not discriminate between India or China or Sri Lanka or Europe or Spain and Italy, Britain. Many of you have seen this. We have heard this. There is any number of there's hundreds and thousands of pieces of information that is out in the media, in authentic sources. I would urge you all to look at authentic sources and don't look at uncertified and unauthentic sources of information on public health, because it should not also scare us. But it is true. Whatever is happening around us is serious. Let us not take it very lightly. And we have to be now prepared to deal with this kind of a situation, because in countries like ours, we have an extremely widespread population, and which is also large in numbers, and we are also highly concentrated in numbers. The density of population in this country is phenomenal. We are the second largest populated country in the world. I think all of us know this by now, after China. And so there is no way we can go and hide ourselves and say that this is a region where there is no people and we can go and all take shelter there and let this virus go away after a couple of months or so. But the thing is that it wants to spread only by attaching itself to another human receptor, which is the ACE2 receptors, which is found in humans at this point of time, because it has now seen that it has been attracted to the human ACE2 receptor. So now it will not go back. Maybe it may be there still in those bats and pangolins and all those other smaller animals too. But maybe the virus has found its best ground, breeding ground, in the human lungs. And that is what is causing all this panic and difficulty for us worldwide. When I say us, I'm not referring to India alone. So we have to be prepared for it. We need to be looking at, there is no, at the present time, this vaccine, this virus is only 6 months old. If you look back into the Chinese data or information, we know that they started having its presence and noticing its um, uh, the rate of infection increasing in the months of November and December. And it took them 2 months to realize that this is a new virus and that they had not seen something like this before. And because of the symptoms, because of the lack of responsiveness of the patients, maybe some of the patients were not responding to any of the medical therapies that is prevalently available in the form of antivirals when they were taken to the hospitals. So China took more than 2 to 2.5 months to understand that this was something different and this was something serious. And they then announced it to the world on December 26th. So this virus has been with us now about 6, 8, 7 months, and that's it. So in order to now move on from here, what do? We have no uh, scientifically documented or proven medication, which is injections or tablets or any other form of curative medication which is used in a hospital setting for these infected patients. So the next thing to look for worldwide was to vaccines, because vaccines are not curative in nature, but they are preventive. So vaccines can be also administered to healthy people. Vaccines are not administered to those who have been infected with a virus or a bacteria. All these things point everybody's attention then started coming on to the vaccines, and that is how the work relating to vaccines has started actually multiplying, or maybe 10 times it's multiplying in as compared to the normal time frame of vaccine development in any country that you can think of. So these pandemics are called zoonotic viruses, and many of them come, like I said earlier, they all come from mostly from smaller animals, and they somehow find the human system more conducive for them to multiply and grow. And that is how, and since we as humans have become a large number in terms of the population, irrespective of the countries, so they find a very easy host system in the human body. And that is how we have succumbed to it. So now coming back to vaccines, I don't want to go into the statistics of what the world and what India is going through, because that is all available to us on Ayush Bharat and all these other Arogya Setu and all these apps that has come up, and also many other international agencies. I would suggest at this point of time, please look at organizations of international nature. The reason I say this is because look at Arogya Setu, no issues. That is for our country, certainly, which is the most authentic data and information that we could get out of. But look at institutions like the WHO, look at institutions like the CDC, the Center for Drug Control, which is in a city called Atlanta in the United States. So these are international organizations which collect strains of these viruses, especially the CDC. They have strains of almost every virus that is present in the world. So that kind of research work happens in that institute, or the National Institute of Health, or in this particular case, the National Institute of Infectious Diseases, which is again in Washington, DC. It is called NIAID. And the other one is the National Health Services, which is again the UK National Authority on Health. The ICMR, the Indian Council of Medical Research, under the Ministry of Health, which is the primary institution in India to give out the most authentic information or useful guidelines that is out there in order to combat COVID. So let us not panic, but at the same time, let us not take it very casually either. And let us not think that the lockdown has been lifted and we are safe and nothing will come on to us. And we can go about meeting our groups of friends or family, or go to the, wherever. Let's not start doing that, at least for some more time. Honestly speaking, I would still think we need to be under a lot of restraint, and that is why the government is talking about still continuing social distancing, masking ourselves, because the way this virus again comes out is in the droplets or in the aerosol form from human to human. So the mask is the best way to protect this contamination going from person to person. So masking is very important. And the third is washing of our hands, which is protecting ourselves first, because we come in contact with so many surfaces on a day-to-day basis, either at work or at home or elsewhere. And we may handle a lot of things, we may touch and come in contact. So we need to wash our hands as frequently as possible, as frequently as we can. I don't mind doing it even every hour. If you have the chance to do it, there's nothing wrong, do it. It's just soap and water, a little bit of soap and a little bit of water that we need, and that's all. So don't get unduly worried about it. What will happen to my skin and what will happen to my hands and fingers, all these things. Don't get bothered about all those things. This year, our life is most important. Let's not forget that. And it is important to protect ourselves, to safeguard ourselves, and to ensure that and in the same manner, we also have to protect our families and our environments that we are in, whether it is the college, whether it's our schools, whether it is our places of work. Most of us, those of us who are not students now, we are all grown up and we all have to go to work. For example, our company, our organization comes under the Essential Services Act, and we continued to work. We did not close down, or we did not shut our company, the offices and the production facilities during the lockdown period at all. All our employees and all our staff willingly were told to come to work. If they had issues in terms of their colony or their housing apartments where they were restricted from going outside, those employees stayed at home. But the rest of them who had no such issues were all coming to work and working on a daily basis. In fact, we had to move them to shifts, because we cannot have too many people on the campus at the same time. And so we ensured that we would restrict the number of human contact within our own facilities, in the buses that we provide for transportation, in the canteen, in the cafeteria, in all these places, in the departments where they have to work together with 30, 40, 50, 100 other people. So we had to restrict the number of people on our campus, and we are working. So you can be rest assured that once we take care of these 3 precautions, which the guidelines have been told very clearly to us by the government, there's no questions about it. It's so simple, and there's nothing to be worried about it. There's nothing to be confused about it. And let us not get into too much of unwanted doubts, or asking, or things that maybe somebody can say, no, you don't need to wear a mask. What is it going to protect you from? Or how is it going to protect you from? I just told you, it's the droplets from our own mucus, the mouth and our nose, the aerosol droplets that you and I cannot see, can take the virus. The virus is not visible to our naked eye. So what do you know and what do I know? That what am I sending out of, if I am an infected person? How do you know that virus from my body or my nose and mouth is transferring to to the other person? So we don't know. So we have to thereby protect us, not us. By wearing a mask, we protect the other person first. That is important. So that's a huge responsibility, that when we wear a mask, we are protecting our neighbor or our family or the next person working next to us. And when they wear their mask, they are protecting us from being contaminated by them. It's not that I'm suspecting that everybody is a carrier, but we don't know. So we have to. So we just cannot take it very lightly or casually. I know it's just a mask, but please understand, this is why it is worn. Masks are worn in hospitals by doctors, by all the medical practitioners, and by the nurses and the staff in the hospitals, because it contains any kind of droplets or transmission of germs and viruses like this from one person to another. So it's very important. And then the hand wash part, which is very clear, I think, to all of us. But the fourth important thing that I also wanted to add to this is please eat healthy food. Why I say this is immunity is very important at this time. The weaker ones, the weaker body, the weaker metabolic system, the weaker the person who has a weaker metabolic rate, or the metabolism of a person, if it is weak, if it is not very strong in terms of the immunity, then that is the person who is now probably more vulnerable. If he or she were to be infected, then their chances of fighting this virus is more difficult as compared to a person who has a higher rate of metabolic rate and a better immune system. How do you know this? We don't know. Again, because you don't know what is your immune levels in your body. And I don't know whether we can go now and check and do all those things. Instead, let us just understand that we all can be very pay attention to what we are eating, and to also avoid certain kinds of food if we can, and not indulge in them. And we should also thereby include a lot of other vitamin C's, which is very good at this point of time for the body to have in good on a day-to-day basis. Have your vitamin C if you can. If you don't want to buy the pills, don't worry about it. There's lots of fruits. You know the best fruit for the season? Go have your mangoes. Eat as many mangoes as you want. You have all your vitamin C's in it. So there are many fruits like this, the oranges, the mosambis, the santras, all of them, they're all vitamin C. So there are enough like that. We have vegetables. We have good nutrients in all our fruits and vegetables. The protein, if those of us who have non-vegetarian food, the proteins are good as well, because that is what you need at this time. So don't stay away from the oily food and the junk food and the stale food and all those processed packaged food. Please stay away from all that, especially the youngsters, for some time. It's not a big sacrifice to make, because nothing is important than our own lives and the lives of our families at the end of it all. Think of it. So stay healthy, eat good food, normal, good food, home cooked, even better. The best is home cooked food. Thank God all the restaurants are still shut, but some of them are still opening up now. But still, the food that our mothers and our grandmothers have made. I have my mother at home right now, and she prepares something new, or tells the helper to give us something, make something different. So this is very nice in terms of bonding with family, learning a lot of things between, from generations, especially when you have a grandparent in the house. This is a wonderful time to catch up with your grandparents. I'm telling you, for those youngsters, keep your keep your smartphones away for some time and spend time with your grandparents, spend time with your families, play a lot of indoor games, keep your mind active and very positive. If those of you who like physical exercises, just go out there for a half an hour or 45 minutes to an hour, walk. The best form of exercise is walking. Just 45 minutes of walking a day is good to keep your metabolism going in the right direction. Those of you who like to do other sports, please go do it if you have access. Those of you who like cycling or walking, running, jogging, whatever you call it, any form of physical exercise which you can prepare yourselves and do, and spare time and do, please go ahead and do it, which is very good because that is the need of the hour. And sleep well. We all need some entertainment. So watch a movie every day if you want. So there's nothing wrong about it. And that also refreshes our mind. Read some books, great time to look at your hobbies, connect with your friends. I've been talking to a lot of my friends who are living in many parts of the world, and we all come on a web call like this, a video call like this, and all of us have been talking to each other more often, more frequently than we have in the past 5-10 years. So like that, family too. Many of us have family now living in other cities and other countries. So connect with families, connect with friends, and read books, take up to your hobbies and passion, and continue to do things like that, which will then enhance your immunity. I'm coming to the vaccines. Normally, vaccines are the best bet that we have right now, but we are going to have some challenges because vaccine production is not that easy. It does not come out on day I can't predict a timeline for it. Nobody can. It's not me. Nobody can predict any drug discovery. If I have to put it this way, any drug discovery, new molecule or a new drug discovery which happens worldwide takes at least 20 to 25 years of research, development, failures, and eventually, if successful, maybe after 15, 20 years. And in between, sometimes it is dropped, that research, that work, that particular processes, everything that is involving that development is dropped because some data was shown which is not acceptable, or some results which come out of these experiments are not acceptable. Because, my dear friends, all of you, please understand, we're talking about biology. This is molecular biology. This is microbiology. This is virology. This is these are subjects which most of you who are in sciences will understand and appreciate and know this, that this is a very, it's a very dynamic environment of living organisms. The yeast is, all these things, the yeast, the DNA, the RNA, the membrane, the lipids, all of these things are they are in a living environment. They're active, they're in an active environment. They're not dead, they're not dormant, and they're not inorganic. So they are in a state of organic in nature. And the bacteria, the yeast, and the viruses, all of them are constantly growing and mutating and changing and adapting themselves. So we have to be very cautious when we work with them. And also, it is because it is human health and human vaccines. These are international guidelines, and also the guidelines that are regulated. When I say regulated, the government of the country, of any particular country you can think of. It does not mean that it is only in India. it can be any country. Every country has its own regulatory organization. It is called the regulatory authority of that particular country. And they come into these processes and these protocols, and it is they who will then tell these research groups as scientists in the universities and the institutions, or organizations like us in the private sector, that if we could proceed with that particular data that we have submitted to them, because everything comes under scrutiny, because again, we cannot be developing ineffective drugs. More than ineffective, we cannot be developing unsafe vaccines and unsafe drugs. That is more important than even the effectiveness of it. So we have to ensure the safety of all the patients and all of them who take the vaccines. The lives of these, all of them are to be protected. So that is why it is a highly regulated subject. It comes under the government, central government, not the states. And the Ministry of Health has a department called the Drug Controller General of India, whose department then monitors every pharma company and every vaccine company that is out there within India, as to the quality standards, as to the guidelines that are being followed, as to what kind of safety measures and precautions, and all these things are actually available to us from international agencies. So we follow these things, and it has to be done that way. Coming to the vaccines, we have 3 projects going on right now at Bharat Biotech, that the organization that I'm representing to all of you today. And we have chosen 3 tracks, not 1, because we want to ensure that we don't, because we have no, I have no promises to start with. When I say my team, my organization, or any organization for that matter, cannot work on one platform and say that this is going to work and this is a sure shot. We can't say it today until until it is proven and until it is accepted that it is scientific and it is authentic and it is safe to be used as a vaccine or drug. We cannot say that I have a vaccine in my hand today, and we are not authorized to do so. So that is very important for all of you to understand. I cannot make my vaccine and I cannot transfer it to the pharmacy tomorrow, and I cannot, I can't expect the pharmacy to sell it the day after tomorrow. It goes through all kinds of government regulations. So that is why it is important that we follow these kinds of stringent guidelines, and we have to then ensure that these vaccines come out in the best manner possible. So we have taken 3 routes, and all of them right now are, one is with the ICMR. Those of you who are in the sciences or in the medical sciences, in related sciences, would have heard about the ICMR, the Indian Council of Medical Research. And the National Institute of Virology in Pune right now is the most famous institution now, if I have to say that, in the sense that it is the apex body where the highest level of research and scientific studies done in viruses happen in India. So it is in Pune, and these strains have come, the SARS-CoV-2 strains have been transferred to us, and we have handled the virus in our facilities in Hyderabad, and we have now ensured that the virus is not it's not going to be kind of, we inactivate the virus so that we ensure that it is not going to cause any further harm to those of my colleagues and my technical and production and the quality control staff and all of them who are working on it. So we have inactivated the virus, and we are deploying it into an antigen, mixing it along with another medium, and that is called the antigen, and then that is given in the form of an injection to be tested in animals. Currently, we are doing animal testing. And once the animal data comes out and it is proven to be safe, submitted to the government and proven to be safe, then we get permissions from the government to take it further and do the human testing, which is required in maybe 100 or 500 or 1,000 subjects. The human clinical data trials have to be done. And that again will be prescribed by the government and will have to be followed. So all this will take months, if not, if we are lucky, maybe within 12 months, we could have a vaccine. That's the best I can say when it comes to vaccines. If we are not lucky, it could be 18 months or it could be 24 months. This is for everybody because none of us in the biological sciences, especially those of us who are developing drugs and vaccines, have a time-bound product cycle. It cannot be predicted by any one of us. And at the most, we go by the best examples that we have, the best experience that we have from the past in adapting those processes and technologies that are required, so that we know that we have certain assurances, but we never know how this virus is going to behave when it is combined with something else, and then it is injected into another animal form or a human body, as to how it is going to develop the antibodies that is required for the human system. So we do it in experiments, in phases. That is why the animal trials is called animal trials, and then we call the human trials as phase 1 human trials, phase 2 human trials, and then phase 3, and then also phase 4, which goes on for even after when the vaccine is made available in the public markets. It goes out. The government wants us to keep on continuously testing the product, even for the shelf life that it is good to be used under. When I say shelf life, those of you who are doctors know this. Every medicine, every medication, every tablet has what you call a shelf life under which it is most potent and most effective. So which is normally sometimes a year, 18 months, or 6 months, or 24 months, nothing more than that. So most of our vaccines have a shelf life of 2 years, that is 24 months. So we keep on doing continuous testing even after the vaccine is manufactured and is sold in the to the public system or into the hospital system. So this is how vaccine manufacturing happens. Like I said earlier, we have not one but 3 vaccine tracks projects which we are working on right now. The second one and the third one again are with 2 big world-class universities in the United States. One is the Thomas Jefferson University. All this is in public domain. So you can just go Google and you can just ask, when you say Bharat Biotech and COVID vaccine, then all this will come out. Everything is, whatever I'm speaking today is in public domain for you. So there's nothing that I have something which is, in my shelves or in my cupboards. Thomas Jefferson is another very big university which does a lot of research work. So we have collaborated with them in order to partner and develop this the route or the option that they have looked at. And we as a manufacturing company and will have to be involved in the human clinical trials because they are not going to be doing that. So we have tied up with them, and that material also has come to India from the United States as we speak. And it's already there. We have already started manufacturing the sample lots that is required for the human trials that has to be done in India, because they are doing the animal trials back in the US. Another institution whom we have collaborated is with the University of Wisconsin, which is in Madison, Wisconsin. It is north of Chicago. And there again, we have tied up with the university and a very good reputed R&D company, which works on flu vaccines. So they are experts in the domain of flu vaccines. So we have identified that expertise in them, and they together, between the university there and the company called FluGen, are both already doing animal trials in the university animal laboratories. So that data will also be coming to us upon completion. It, I think, has started in April. So we are hoping that we will have data coming to us as early as July. And then we could, from there on, kickstart a program on the human trial data that needs to be done in India. So this is how all these three tracks of vaccine development will start happening in India. Two of them for us have already started as I'm speaking to you. And we just have to go through these steps. There is no other way that I can come and say that I have a solution tomorrow. It's not going to happen that way, unfortunately. For a very, in a lighter way, I would like to just bring this comparison. Mathematics, we have equations. Mathematics is a subject where we all, whatever mathematics I have studied, I know that there are equations, and then we start solving it, and it is mathematically done. There is a template for it, and then we go about solving it. Physics, there are laws, and the laws are proven again, and these are physical laws, and so it's predictable. To that extent, it's all predictable, and it can be proven if you follow that pathway or that particular methodology that has been taught to us. And chemistry, we have formulas. So again, these three subjects are very close to biology, which is the fourth one, in my opinion. But biology has none of these, of the above that I just mentioned. There is no equations in biology. There is no laws in biology. There are theories. There is data, and there is a lot of evidence. There is a lot of internet published journals and papers and publications, because we do that too. We publish enormous amount of publications related to our vaccine research. So we understand that there is a lot of data, scientifically proven data, but there are no laws, there is no formulas, and there are no equations, unfortunately, in the biological sciences. So we have to be a little patient. We will try our best. We are, as a country, in India, we have at least 4 large vaccine manufacturing companies. There are some more. There are at least 4 to 6 large manufacturing companies that are already manufacturing vaccines, and most of our vaccines are also being distributed to other parts of the world. So don't think that we as Indian companies, let's not have those doubts. Okay, let us be very clear on that. I want this message to go out because again, we have a lot of questions, which is common, which is natural to have. But let us not doubt or have second thoughts about the competence and the capability we as a country have at this point of time. When it comes to drugs and when it comes to vaccines, we are good to go. As long as we can get the processes right and we can finish and complete all that levels of work that has to be done and prove it scientifically and to the government and to the authorities, then we are good to go. We can manufacture millions and millions of doses of vaccines and drugs in India. Hyderabad is a capital for the pharma industry and life sciences, again, the vaccine industry, the biotech industry. 70% of India's vaccines are made in Hyderabad. So you can understand how strong we are as a country. There are there are a few other companies in Maharashtra, there's another company near Delhi, there's other companies in Gujarat. So we have a good number of private sector and companies which can handle this kind of vaccine production that is required for the country. And even the same thing goes for drugs. So don't think that we as a country don't have the expertise in order for making drugs and other formulations that are required, if at all, even if new therapies are found for effectively treating the COVID-19. Then we have any number of companies, drug companies, pharma companies in India, all over India, Bangalore, Chennai, Hyderabad, Mumbai, Delhi, you name it, Gujarat, you name it. There's any number of pharma companies that can deliver this kind of drugs, that can manufacture this kind of the drugs that are the antivirals, the new antivirals that are required to treat COVID-19. So please be very confident on this note. Don't give up hope. And I'm certainly confident that as a country, we will be able to not only make vaccines and drugs for our country and for our citizens, but India will be certainly will be in the top 10 nations of the world making vaccines and drugs for the rest of the world. On that happy note, I will sign off. And if there are questions, I will take it. Thank you very much. Dr. Lakshmi Prabha, was that okay?
Yes, madam, that was excellent, madam. Thank you very much. That was really...
I'm sorry, maybe if we ran out of time a little bit, I can understand.
That's okay, madam.
But if you have some questions or
yes,
anything...
there are a few questions, madam.
Please go ahead. I will try to keep it as brief and as simple as possible. Okay. I hope it was simple. I hope it was simple enough this time.
You have made it simple. You have brought it to our level. You have brought it to the understanding
what I mean
is because we have people from different disciplines.
Exactly.
So if you go too technical and too deep into one area, the others may feel at a loss.
Exactly. That's if I have to speak to doctors, I cannot speak like this.
Yes, definitely, I can understand. It was a beautiful, very comprehensive presentation, madam, and you have boosted our confidence in our pharma sector. So
yes, we should be. We should be very.
Yes, madam. People like you in the forefront, you have nothing to fear, I feel. And there are a few questions. One person, Meena Chandalia, wanted to know how do they tackle the alveolar macrophages? This is, I think, a question related to biotechnology and biochemistry. So macrophages at the alveolar level, how is it tackled? That's what she wanted to know.
Is it in respect to COVID or is it?
I think she wants to know with respect to COVID, because this virus, when you are developing the vaccine, or rather, I think the virus, how does it, affect, or the vaccine, how do you plan to tackle the alveolar macrophages?
Perfect question. I will answer this in a very simple way. Yes. We deal with such viruses, zoonotic viruses. Rabies is a zoonotic virus, which is again the host system is the dogs.
Dog, yes.
Right. And then we have also done the Japanese encephalitis virus.
Yes.
Again, the vaccine. I'm sorry, the vaccine.
Yes.
Which is again a zoonotic virus because it again the host system is the swine, which is the pigs. That is where most of the this breeds. The Japanese encephalitis virus breeds in this system more, and we have handled that. We basically what we do is we kill the virus. We attenuate it so that it is not in a live. It's not virulent. Exactly. Yes. It does not cause any harm to anybody who's handling it. Even right now, like I said, my own staff are handling the virus, though not touching it physically, but still they are in that same environment of the production environment, and they're in the closest contact with the virus, just like our doctors and our nurses and all the other first responders we have. So we normally, in the process of making a vaccine, the virus material, the virus particle, whatever we take from the virus, which is a protein or which can be an RNA component of the virus itself, or which could be a membrane or something, any of the cellular nature of that virus is what is taken out of it. It is killed, it is attenuated so that it does not have its virulence, and then it is mixed with a adjuvant and made into the form of a antigen, and then it is given to the animal or to the human body. So we will ensure that everything is arrested. No contamination will be there by any bacteria or by any other form of biological organism that is out there, because otherwise no vaccine can be made.
That's true. Yes.
It just doesn't apply to SARS alone. It would be the same for any vaccine, which are especially the viral vaccines. All the viral vaccines, we take all these precautions, and so that it will be very safe to be administered. Yeah.
One more question, madam. They're asking the plasma treatment. We have been reading also in the media that plasma treatment is being applied. What they were saying is that plasma treatment has not succeeded. So what could be incorporated in plasma treatment in order to meet with success? Because they have taken cured patients.
In all fairness,
yes,
I'm not a doctor, but I should not comment on. It would be unfair on my part to comment on it at this point of time, because anything related to COVID, I request all of you listening to me today to bear with the science for some time, because there is not going to be magic answers, and it is not going to come in a short amount of time. Everything, anybody is doing out there in the world today is out of their sheer scientific commitment and passion to demonstrate or to develop something that could be meaningful and could be used to the human race. It's not about countries here now today. In one way, COVID-19 has brought many countries together.
Yes,
many countries together. They are just yesterday, I think North Korea and South Korea have started talking. So I think I just saw it very, very, in minutes or seconds. I didn't read much about it yet. But if this is happening, then that means you can understand the impact that this kind of global health impact that this virus has created, not just for a country, but worldwide. But certainly bear with the science. If plasma therapy doesn't work, something else will come. Monoclonal antibodies will come. Those of you in biotechnology and in the life sciences, I'm sure have heard about monoclonal antibodies, right? So that also again has to, is by isolating the antibodies that have been created in those infected and recovered patients, and then later on used in a technology in a safer manner in order to then increase the volumes and bring about higher dosages. So that is also something that we are working on right now. So let us give some more time. Let us be hopeful. If plasma in the beginning also, I will tell you one thing. It could not have been used for, it is only for, it is a therapeutic approach. It is for someone who is in acute, at the final stages, under the ventilator, in the hospital, in the ICU, and at a very, very final stage of maybe the doctors feel that they will need the antibodies that have been derived from the plasma of that has been taken from those patients who were infected prior. So this is for those level of patients. So plasma therapy is not something that today, if a normal, many people you would have heard of, maybe in your own friends and groups, so many are self-quarantined
Yes, ma'am.
with
Yes.
symptoms, or maybe after a week and 14 days, they fight it out. Because
Yes.
that's why I said the immunity is so important for us, that our own immunity will fight it out. But unfortunately, the ones that can't fight are the ones who have these comorbidities, which all the medical fraternity knows, that if they are diabetic, or if they are hypertensive, or if they have any other ailments, asthma, pulmonological problems, yes, bronchial pulmonological problems, heart disease, kidney disease, anything else of that nature, cancer, unfortunately, because all of them have been taking long-term medication for those diseases that they already have, and their immune system is weak. Their because they are on drugs, which suppresses their immune system, and most of these drugs are meant to do that. They suppress the immune responses in the body. So it is those people, unfortunately, and the elderly, 60, 70, and 80s sometimes, have unfortunately succumbed due to these comorbidities. So let us please understand that plasma therapy, if it doesn't come today, maybe it will come in 6 months. Let us hope. I think this is the time to hope, and hope.
Definitely, yes, yes. Even I was actually planning to ask you as to when is the vaccine likely to be released. So you have answered it in your session itself. You have said
I
you're
did.
very
Yeah.
Many of our questions that we had in our minds as we came to your session, you have answered in your presentation.
Oh, okay. That's
So we
nice.
wanted to
That's
know
very
all
nice
these
to
things,
know
ma'am.
that.
Yes.
Thank you. Thank
And,
you. But if there's still any, I would, if I can, I
yes,
will
ma'am,
answer.
definitely. And
Please.
also, they were asking about how knowledge of Ayurveda could be integrated. So I was just thinking, you were mentioning to follow the Setu, Arogya Setu app, and Ayush Ministry, Ministry of Health. So they've already given these things. And again, one person wanted to know which would be a reliable source to get the information pertaining to COVID-19. That also you have mentioned in your presentation.
I can ask Aditya to my office to share
the websites.
my office, Aditya, who has been communicating with you. I will ask him to prepare an email, or an email with all the links pertaining to all these institutions that you can then share to all your participants. If it is useful to them, I would certainly suggest that they should only read authentic information, which is very important.
Otherwise, people get worried.
Exactly. I don't get worried about WhatsApp messages. Social media and WhatsApp, please not now. Use it for jokes and small things, simple things like that, but not for serious matters like this. But authentic data, yes. If you have authentic data, send it, share it, because it is good. But don't get unnecessarily carried away by rumors, and don't then, because it disturbs the whole, not just us individually, but the family, our group, our friends, the workplace, everybody gets disturbed. Your point, ma'am, about Ayurveda. It is very apt for us to now, I think, as a country, draw upon a lot of knowledge that we have in our own heritage as to how, in all these forms, even naturopathy and Ayurveda, I think, and Unani medicine, of course, too, homeopathy too. See, again, we are not competing with anybody. So if Ayurvedic, there are compounds in Ayurveda which will enhance their immune boosters. Like that's how today we call it vitamin C. But our grandfathers did not know it as vitamin C. Ma'am, you're all experts and you know what I'm talking about. Our grandfathers and grandmothers never knew vitamin C. They would only give you orange or mango or, an
Amla.
appropriate.
Amla, madam.
Amla,
Amla
of
made
course,
into
I
a pickle
forgot that.
also in our households.
Absolutely, it is a part of our kitchen.
Yes,
Every
that's
kitchen,
true.
every household will have amla. So all these youngsters, please go to those little stores in your colonies and go ask for all these Indian fruits and Indian, vegetables and many good things that have a lot of nutrition and good
Immune boosting
balanced
capacity.
nutrition.
Yes.
Yeah, that will enhance our own immune. They act as our own immune boosters. So please take whatever Ayurveda says in terms of whether it's fruits, vegetables, or there are some compounds which they may have created. There are a lot of formulations in Ayurveda which are safe for, I don't know, for big disease burdens, but certainly for improving our own immune system. I think we can. Naturopathy doctors are also there because they also suggest a lot of things like um, garlic, jeera, ginger, turmeric is another one which is now everybody is pepper. So a lot of such compounds which we have in our own backyard, in our own kitchen and shelves. Yeah, so please rely on these things. Absolutely, use it for your best advantage. And we are lucky to be in India. I think so.
Very much, madam.
At this
Very
particular
much.
time, I've lived abroad, so I know what they don't have, and and I'm living here now, so I know what we have here. So it's let us take the best of it and make ourselves better.
Yes. So these were some of the questions, madam. Then also one more person wanted to know that they have read in news about I mean, already human trials have been done in Russia. So they wanted you to comment on that. Already
For a
330
vaccine?
humans have been tested, yes. For a COVID vaccine, it seems he has read somewhere that
Okay.
on 330 humans have been tested. So they wanted to know your comments on
It's
that.
possible, because it's possible. I'm not quite alarmed by it at all because I have not read it. I will call for it, or I will look for that data.
Okay.
As long as it is announced by the country's regulatory mechanism, whatever that is, whichever that is, the Ministry of Health for Russia has to make that announcement.
Publicly.
As a company or as a private organization, I can say it, but the approval process and the final authority is that particular country's health
Ultimate
ministry.
authority. Yes,
Health
top.
ministry,
Yes.
yes, their appellate body, their health ministry, who has to ultimately give them, yes, go ahead and make the vaccine and make it available for the larger population. Right now, they may be testing it in smaller numbers. That's what I said. We test it in 100, 200, or 500,000 volunteers, human volunteers. And we are making samples too. Without those samples, I cannot test it. Starting in the next month or two, we have to start testing too. So many governments have now started telling the companies and the researchers that you can do parallel testing of animals as long as the safety is proven in animals, because this is a pandemic and this is it's urgent. The time is of the essence. Yes, time is of the essence. So the governments, the regulator then tells, do parallel testing. As long as I can prove that the 10 monkeys that we used did not die tomorrow after taking the vaccine, then the governments will say, okay, go ahead, try it on 10 humans first. And if those 10 humans have also been saved, then they'll say, do it in 100. So parallelly, they will tell us, you can start doing some of these trials. That is why fast tracking can happen. And that is exactly why I said earlier that in pandemic scenarios, such decisions can be taken by the governments, by the health ministries of those governments, and they will ensure that they have to ensure safety, which is very important, because they cannot sacrifice one for the other. And at the same time, they will also want to ensure how best and how quick and how effective a drug or a molecule or a vaccine can be brought into the market.
Yes, okay. That was excellent, madam. Thank you so much. I think with that, yes, we wind the question and answer session.
Okay. Okay.
I deem it a privilege to express my thanks to Mrs. Suchitra Ella for having spared her very valuable and precious time to be with us virtually and share her work and views. I'm sure all the participants have thoroughly liked your presentation, madam, because in the chat box, there are a number of comments of appreciation. Very
Thank you.
appropriate, very nice, very, she has explained very well, very relevant.
Thank you.
So,
Thank you.
all those kinds of words of appreciation you've got.
Thank you.
We wish you all success, madam, with reference
Thank
to the
you.
production of the vaccine. And after
Thank you.
hearing your words, we have got some confidence
Of
that
course.
yes, we are in safe hands, and very soon we will hear about the vaccine. We wish you real success very soon, madam.
Thank
And,
you.
on this occasion, I would like to place on record my thanks to Mr. L.V. Subramaniam, IAS, former Chief Secretary, Government of Andhra Pradesh, my elder brother, for facilitating Mrs. Suchitra Ella's session today. Thank you very much, madam. It has been an excellent session, and we have thoroughly enjoyed it. You have given us a lot of information on how a vaccine is produced and what is done at the end of the pharma company. Thank you so much. I would also
Thank you very much.
Thank you, madam.
Yeah.
Thanks a
All
lot.
of you, please be stay safe. I request all of you to take care of yourselves, not only yourselves, but the responsibility of taking care of your families and friends and colleagues at work, because today work and family is together for many of us. And so please don't differentiate it, and be careful. If only you have to want to go to the temple, go to the temple or church or the mosque or wherever your place of worship is, because God is everywhere. We can worship him from right sitting where we are, and he is internal within us as well. I'm sure his blessings will be with all of us. And don't lose hope, but be careful. And even if you have to travel, please be careful. Don't take all your family members. Maybe only one or two of you, if you can go, and if you can manage that situation, try to be a little bit more, practical, and think of safety first. Don't expose yourselves or anybody unnecessarily, because asymptomatic symptoms, carriers are, you don't know. You don't know. So, yeah, it's not at all visible to us, and nobody can tell us. No doctor, nobody, no test can tell us. So it's very difficult for that 15, 21 days. All those asymptomatic carriers who are out there, we don't know. So please be cautious. Take all your precautions, and when you're going outside, ensure that your mask is on, and please carry a hand soap or a little liquid soap. Nowadays we have a lot of things that have come in the market. We can spend some money. Anyway, we are not going to the movies and to the restaurants, so all that money is going to go to the to the sanitizers and to the soaps. So it's okay. It's okay, because like I said earlier, our life, if we can take care of our life this time around in 2020, then we can take care of the world and the society in 2021. I'm sure that's the hope and confidence that I have, and wish you all,
Thank you very much.
wish all of you to be safe and take care of yourselves. Thank you so much. Keep praying for us.
Sure, madam, definitely.
Thank you.
I would also like to thank Mr. Aditya and Ms. Meenakshi of Bharat Biotech International, Hyderabad, for their help in organizing Suchitra madam's session today. Thank you very much, madam. Once again, namaste. Thank you.
Namaskar. Namaskar. Thank you.
Thank you. Dear participants, I hope you enjoyed Mrs. Suchitra Ella's session. You have heard from the person who is directly involved in the production of the vaccine, and we have come to know, many of us may be already knowing, that Hyderabad being the pharma capital, and with so many firms involved in active research to develop a vaccine for COVID, we can all be confident. But till the vaccine comes, let us all be safe, as madam has also advised. In all the 3 sessions that we have come to know about the draconian impact of the pandemic COVID-19. It is truly worrying. Also, the extended lockdowns have necessitated certain changes in our lifestyles and lives. All age groups of people are experiencing stress of varied seriousness for a multitude of reasons. Almost all are missing their regular venting mechanisms, be it playgrounds, work support groups, social networking groups like kitty parties or evening walk groups and so on. Then what do? How do we cope with the stress? How can we get out of it? Our second and the last session for today is a possible answer for all these concerns. It is titled Coping Strategies to Face a Crisis. The resource person is Dr. Malladi Srinivasa Sastry, a young, progressive thinking, highly conscientious consultant psychiatrist who also believes in the relevance of being an inspiring, dutiful citizen and playing the role of a mentor to youth. I request Mrs. V. Soni, Assistant Professor, Department of Home Science, to introduce our resource person for the second session. Over to Mrs. Soni.
Thank you, ma'am. Good afternoon, everyone. I'm Ms. Soni, Assistant Professor, Department of Home Science, St.Joseph College for Women, Autonomous. It's my privilege to introduce the eminent speaker of today's session, Dr. Malladi Srinivas Sastry, sir, who is currently working as a senior consultant psychiatrist. Sir's main objective is to promote mental health in the society through education, workshops, and campaigns. Srinivas sir started an urban clinic named Arogya Raksha Beachfront Clinic and a rural health service called as Arogya Raksha Polyclinic and Diagnostic. Sir has done his MBBS from Andhra Medical College, MRCP from Royal College of Psychiatrists, UK, and also completed a CCT, Certificate of Completion of Training in London. Sir focuses mainly in neuropsychiatric patients and geriatric psychiatric patients. Sir had an experience as a consultant psychiatrist from the year 2010 to 16 and as a senior consultant psychiatrist from 2016 to 19 from the Institute of Mental Health, Singapore. Srinivas sir has training in the use of principles of cognitive behavior therapy, interpersonal therapy, dynamic psychotherapy, and supportive therapy. Sir has received many awards and prizes, among them Fall Championship in 2012, recognized as a Best Reviewer by Singapore Medical Journal in 2014, Gold Award for 2 CPIP projects in 2014, and 5 years long service award in 2016. Now I request Srinivas sir to take over the session. Thank you, sir.
Thank you very much for the kind introduction. Am I audible? Is my voice clear?
Yes, sir, it's clear.
Yes, sir. Is it clear?
All right, good. Thank you so much. So, good afternoon, everybody, and thank you for your patience for staying back to hear me, although we are quite way behind time. I still need to do justice to the topic I have chosen, and I hope I wouldn't need to rush through as well. I hope, again, from the organizers, do we have enough time? What will be the time to close the session? Can I know the time so I can be prepared for that? What time are we going to close the session?
Dr. Garu, you can continue for your presentation, Dr.
Okay,
Garu.
okay, that's fine.
Please take your
Okay,
time, please.
sure, sure. Thanks for clarification.
Okay.
Okay, all right. So for the participants, it'll be a packed session because I have quite a few slides to show. So you will be busy engaging your eyes and ears. So kindly pay all the attention and reserve any questions. I'll be very happy to answer any questions towards the end. As Madam has kindly kind of given a preview, we are going through a crisis kind of a situation which we haven't come across in our lifetime at least. And there are going to be all of us experiencing all sorts of kind of issues, fair enough. But my job today would be to talk about a larger perspective on how do we keep ourselves well, mentally well. And I will touch upon aspects of illness as well for us to be, just to be aware in case something happens and what kind of support we need to look for. So there is a disclaimer here that this talk is ideally suitable for those beyond the age of 14 because the content will be a little mature given the nature of concerns we have around coronavirus. I will call this a bold perspective, bold in its outlook, objective in appraising the current scenario, locally relevant application of global learnings. What do I mean by global is also important here. We often kind of, at least in the current era, global somehow tends to mean Western thought alone. But I think we need to learn to appreciate that we are not truly global unless we are everybody, Western and Eastern. And as Suchitra Madam has very well elucidated, there is a room for our native wisdom as well. We shouldn't really forget the huge importance we need to pay towards our native, anybody's native wisdom, any culture around the world. And I would like to be decisive and clear in conveying my messages. Numbers do matter, especially all of us nowadays have a touch of science in our education, and we do refer to statistics. If we look at this data here, this is from yesterday's WHO coronavirus count. It's a staggering number, isn't it? The number itself concerns us, worldwide numbers and India numbers, and they're only increasing every day. They're not going to be going down very soon, unfortunately. And we will see more and more of this on a daily basis. But how do we make sense of these numbers? If you look at the bottom part, it talks about number of deaths, for instance. I know I'm talking about tough concepts here. Nobody really wants to hear about death and dying and all that. But I think let us be a little mature, as I said earlier, about the kind of discussion we need to have here. So worldwide, if you look at it, the percentage of deaths seems to be around 10%. In India right now, the percentage of deaths seem to be 5%. And what does it really mean? It means 9 out of 10 actually survive if infected. So I'm looking at the positive lens here. So instead of saying 1 out of 10 actually die, I'm actually saying 9 out of 10 survive, and that's a huge number. So a lot of us can be infected, but at the end, a lot of us would survive. All right, so that should give us some courage and confidence. But who is more at risk? Surely the elderly and those who are immunocompromised, as we heard earlier from the earlier speaker. Healthcare staff surely are doing a really good job, and they are struggling across the globe. In fact, recently, only yesterday, somebody sent me a video of how junior medical staff in Gandhi Medical College are actually struggling, and they are protesting, wanting more kind of resources, I guess. And the policemen. The ones whose livelihood is affected mostly are the migrant workers. So we need to really take care of them and respect them, whatever we can do in our capacity. I think mental health would do well, as in we looking after ourselves and looking after everybody else. The very aspect of looking after everyone else should give us a lot of comfort, happiness, and pride that we have been useful. So one of the things we should definitely focus on when we talk about mental health is not about me alone. It is me along with everybody else. But what do you say about this? And look at the shocking cues. I mean, this has been seen across the nation wherever the liquor shops have been opened. It's almost like a triumph, isn't it? What emotions did you have when you saw this on the streets? Was there anger? Was there shock? Was there a fear that such a huge gathering, the numbers of infected are only going to explode? And you would have felt like saying, hello, have you heard of Corona? Have you? And you would have wondered, what are their priorities? Did they get their priorities wrong? See, not all questions have answers. And this is just an example I tried to show. An example of coping with problems beyond our control. We need to learn to focus on what we can control and leave what we can't. I know it may sound escapist, but let us be realistic as well. See, people are different and they don't necessarily share the same concerns as you do. So we need to learn to let things go. We can practice forgiveness. It is something which is talked about from a spiritual point of view here, but it's an extremely helpful coping mechanism. When we learn to forgive, we experience the peace within. And we should really applaud how well the community has come together to support those who are in need. We have had several celebrities actually donating huge sums of money to the Prime Minister's Relief Fund. And I have come across so many on the streets, youngsters even, who have been driving their two-wheelers and handing over food packets to those who are stuck on the streets. And it's so nice to see that. And we need to celebrate this side of our human response. And we need some humor in tough times, which is good for health. Our Superman is doing the right thing by staying home, he says. He doesn't need to go out to fight anybody. And our young, well, not so young husband is happily watching the sofa and he is clapping hands for 5 full minutes every day, says his wife. And he's not helping any more than that. That's for fun. But let's face it, see, life was never designed to be easy. Life was never designed to be comfortable either. And life was never designed to be risk-free. There were epidemics and pandemics. But how did the ancients cope with tough life? So let's have a look at that. Ancients, it was a luxury if somebody lived full 100 years. There were quite a few who lived, but still it was a luxury because there were so many illnesses, maternal deaths during delivery and so on and so forth. So deaths were a frequent occurrence within a family, natural and unnatural. Miseries and hardships were not uncommon. And this was often thought to be expected in life and required for realization of divinity. If you come across so many saints and poets in the ancient times, medieval times especially, a lot of them actually touch upon this and express their a longing to be released from the miseries of life as such. So life was therefore accepted on its terms with humility. There was the required cognitive advancement as a coping strategy. And you would come across this in lots of kind of ancient texts. For instance, Panchatantra. If you read the Panchatantra, the original text itself, I was actually spellbound to see the depth in understanding of human mind. Same goes with the Upanishads or Bhagavad Gita and lots of other texts, Buddhist Jataka tales, for instance, and Buddhist concepts of sutras. They are advanced psychological texts, and a lot has been replicated in therapy forms, especially the mindfulness therapy in the modern times as well. Worrying about world problems is often an excuse for not working on our own problems. This is the essence from one of the shlokas of Bhagavad Gita. And what about emotional awareness as a coping strategy? Well, again, beautifully, the ancients really understood the range of emotions, and they've displayed this through Natya, the dance, and even in the music. There were so many ragas framed depending on the mood. Can you believe that? So you can understand the depth of an awareness that they had about emotions. And these are called Navarasas, the 9 moods. And so far in our presentation, we have already seen Karuna or compassion for the elderly, Bibhatsa, the fear of what may happen to us in the current situation, Raudra or anger if we see somebody flouting the rules of lockdown, Hasya or joy when we see a bit of a joke and have a little fun time within family, and we all wish to have peace or Shanta. On the other hand, modern life, I believe, is actually a dream come true. I'm sure we all agree with that, but let's see why I want to say this. Modern life is special. It gives us security in all aspects. There is a predictability. It is thoroughly entertaining. It is comfortable. Look at the amount of luxuries we actually have nowadays. It is information rich. And there is advanced medical care. And we are actually living longer. Japanese, actually, there is a particular book called Ikigai. And in that, there is a celebration of how old or how well the elderly are living. So modern life is actually very special. In fact, till 20th century, there was no concept of fixed boundaries of countries, and that gives us lasting peace. There is a concept now of world bodies to deal with global problems. The advanced medical care to treat most difficult problems and reviving life from jaws of death through cardiac resuscitation. This was never possible before 20th century. And the financial security we all have. Once we retire, we have insurance plans, pensions, and so on. Then we build strong houses to withstand fiercest winds and rains. We have 24/7 water supply and electricity and amenities. There is no shortage of food nowadays, and we have global cuisines coming to our doorstep. And there are range of unlimited options of entertainment catered to all sectors, all age groups, you name it, everybody is taken care of. And it feels really like it can't be any better. So I take the viewpoint that we are actually privileged right now to be living in this modern era. Therefore, we need to cast aside our fear, and that is one important lesson. Modern life is giving us more material things than humans could ever afford or dream about. Therefore, we should be content. We should appreciate what we have. We don't need to ask for more. We should learn to share. A lot of us do share, but we need to share, continue to share whatever we have, and be thankful for what all we have. But the big catch, abundance comes at an expense. Well, if you look at the law of nature, energy stays constant. If you move dig something out of earth and create something, there is a loss somewhere else. So if I consider this to be a deep material indulgence, the modern security, the modern life that we have does give us a sense of deep and persistent desire for security all the time. Securing my life, securing my career, securing my finances, securing my health. There's no end to that. And naturally, when we are craving for it, it is understood that there is a fear. What if this happens to me or my family, and so on? In fact, prolonged experience of comfort and security de-skills our mental resilience. The American Psychological Association defines mental resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or even significant sources of stress. And right now, yes, we are facing an adversity, and there is tragedy surely in some families. I mean, if you look at some of the videos from Italy and so on, your stomach, crunches. So mental resilience is a process of adapting to all these things, and we are good at it. Humans have time and again shown the ability, have shown the ability. So what else? Apart from the sense of security, we have been using our senses and mind endlessly. If you're at work, how many years do we work in our life? Almost 40 years. 365 days a year for 40 years, prime years, you're working almost like from morning to evening. And what do we use? We use our mind a lot. And then when we come home, we are tired and we entertain ourselves with using our senses and perhaps overusing those senses. And not just work, even for competitive academic studies. So life is truly a race. There is no doubt about it. So unlike before, there is a lot more use of senses and mind. And our emotional strength is not entirely realized. What emotions we use nowadays are mostly the positive emotions most of the time. When we see a movie and we enjoy, when we have a company of friends and we enjoy, and so on. So there are mostly a lot more of positive emotions are realized. But I guess negative emotions are less likely to be realized. But I'm not saying this. I know there can be a skewed picture here. Those who are not really privileged would obviously have a lot of these affecting anyway. And about the preparedness to face adversities isn't trained at mind level. A very famous quotation from the Sanskrit text is Mana eva manushyanam karanam bandha mokshayoho. Mind is the only cause of attachment and liberation. It's for us to use the mind for the right purpose. Well, interestingly, just a few days ago, I have come across a couple of cardiologists from America write about the very aspect of resilience, mental resilience, and lessons from Bhagavad Gita itself. So as the earlier speaker has said, perhaps time has come for us to dig deep into what we have in store from ancient times. And one of the things that I have commented, Bhagavad Gita teaches not to let fear hold one back, to quieten one's mind with mental focus and resolve, especially in difficult situations. The frivolities that we are as a society had previously invested in no longer seem relevant or important. The collective thought that has floated higher, what is the meaning of life, has been felt much more acutely among healthcare workers. So there is a lot of psychological wealth we can actually dig from the scriptures themselves. And it goes on to say about the negative impact of attachments. Anything that we are attached to in our lives is likely to lead to negative cognitions and negative emotions. And the last part of the deep material indulgence is the material indulgence itself, which is fed by exploitation of world resources, devoid of spiritual or inward core human growth. Okay. The modern world is a much better place, as I've mentioned already, than ever before, and there's no doubt about it in my mind. The only thing is, it is a better place in material sense. However, can comfort and security take away the suffering? I'm sure most of you know who Prince Siddhartha is. For those who are not aware, Prince Siddhartha is the same person who became Buddha later on. Now look at the irony. Prince Siddhartha was kept away from the worldly affairs by his father. He was given thorough entertainment. He was given all the luxuries, and the father made sure that he would not come across any misery whatsoever. So Prince Siddhartha's worldview, imagine, was one of a lot of wonderful things, and entertainment and enjoyment and so on and so forth. In a way, it can be a little similar to the modern worldview as well, at least from the sophistication point of view. But then Siddhartha had 4 sightings, 3 reality checks, and a hope. So when he ventured out one day, and he came across an old person, and then he came across somebody who was sick, and then he saw somebody who was being carried dead. So those were the 3 reality checks he had, and he suddenly started wondering, oh, all that I thought earlier isn't true after all. And then the fourth sighting was the hope. He saw a sage who was actually meditating to understand the purpose of life. So that was Prince Siddhartha before he became Buddha, the enlightened one. Modern world is just a distraction, and I'm sure we would be better off appreciating it, because the more we become busy preoccupying ourselves with entertainment, the far removed are we from reality. So it just needs a touch of enlightenment or a touch of universal values to give us the emotional balance to withstand turbulence, the cognitive awareness of the complexity of our world. See, our world is complex and it is in several dimensions. And having the right kind of cognitive awareness helps us a lot. And all this will help strengthen our core inner resilience to face calamities with courage. I belong to the Royal College of Psychiatrists in UK, and it has, earlier somebody was asking about what are the resources, at least from a mental health perspective. Please visit the website of Royal College of Psychiatrists, and it is a very good resource for understanding mental health issues. And they have also published the mental health, coping with mental health during COVID. So how do we care for mental health during COVID crisis? 1, how do I keep up to date? 2, how do I stay mentally and physically healthy? 3, how do I cope better with self-isolation? And how do I seek help when I need it? Royal College of Psychiatrists says it's easy to feel anxious and overwhelmed when you are constantly hearing a lot of negative news. So it's important that you don't keep checking the news or social media for updates on COVID-19 all the time. I must have added there, should have added all the time. Do keep checking, but not necessarily all the time. We often talk about good news. Everybody wants to hear good news, isn't it? I mean, how many of us really see good news in television and newspapers? When we actually talk about good news, we immediately think of positive stories. But nowadays, the situation is such that Any news is good news as long as it is factual and not fictitious, as long as it is not sensational. And we need to decide what is news and what is nuisance. We are often guilty of sharing a lot of nuisance in social media, forwards, for instance. So we need to learn to share only if things are relevant. And much better would be only share if created by you and me. And then one better coping strategy I would recommend, let the news come to you. Don't go looking for nuisance. And go to reliable sources only, such as the government websites. If we practice this effectively, I can assure you that the anxiety levels are going to come down dramatically. I personally have not read a newspaper for 2 months and not watched a single news electronic media for 2 months. And news comes to me because there's so many people in WhatsApp groups somehow, and somebody else is going to say something to you anyway. Fake news, let's stay away from that. And the obsession with the daily news. I keep saying in my workshops, perhaps 200 or 300 years ago, there was never a concept of daily news. Perhaps news would come from whether a pigeon flying from a king or somebody running a distance and delivering the news. And this is a modern day obsession. How do I stay mentally and physically healthy? We need to keep a routine, focus on activities that you enjoy, take good care of yourself, keep in touch with friends and family. Now it's a reality that we socialize virtually, and let us be responsible on that. There are so many people preying on vulnerable people on social media, especially Facebook. Particularly, this is important for parents when they allow children to be on social media. Please pay attention to that. Let us responsibly socialize. It is a responsibility for us, for all the family members, and for ourselves. And use social media positively. And then how do we cope with lockdown or quarantine if that happens? For everything, awareness followed by action is the way forward. Awareness of what is likely to happen. Like, for instance, when we are stuck indoors, we are bound to become a little lethargic. We may be uncertain as to what is going to happen next, and we end up using a lot of gadgets. And we may have reduced access to amenities and even help, including medical help. And that awareness is important so that we can take necessary actions based on that. And what kind of actions can we take? See, in tough circumstances, no one is exempt from feeling low in mood. Neither you, neither me. It could be the best motivating speaker, but still we are all humans at the end of the day. No one is exempt from feeling low in tough circumstances. But what we can do is we can talk about how we feel. Talk to the person who you trust in your family or a friend. Or if there is nobody like that, surely a professional will always be a better person to keep confidentiality intact for whatever you want to say. Write down your thoughts, particularly the creative ones and the positive ones. Use gadgets responsibly. When I say responsibly, I'm trying to convey the message here that by the time lockdown ends, there will be a lot of addicts on gadgets. We need to be very careful not to get addicted to that. It's almost like a way to escape from the real concerns out there in the world. We need to go back to old days, like using a pen and paper. There's nothing wrong in it. Read books, happy ones. Make effort to laugh and smile daily. Well, even if it is a little artificial. Just stand in front of the mirror and do a nice big laughter, smile to yourself. See how beautiful you look with your smile. You know, all these things really help. And seeking help when need arises. Who can be better than Michelle Obama? I really admire this one talk by her, which actually meant a lot in removing stigma around mental health. Among various things that she has said, she said, we need to teach our kids that mental illnesses are just like physical illnesses and deserve the same kind of care and compassion. She also went on to say that let us treat mental illness just like how a bone or a liver or such things or a heart is affected, so does a mind or a brain. So seeking help when need arises, seek help professionally. Seek professional help, It could be in a clinic, but depending on the lockdown scenarios, online consultation may be available. For instance, some of us are doing online consultations. We are available online as well. Mental illness is no more a taboo. Like any other field of medicine, psychiatry adheres to evidence-based practice. It's not a mumbo jumbo stuff. Some people may have this impression that, oh, psychiatry, God knows what they do. But that's half, well, it's not even baked news, is it? It's not a very good impression to have. Please find out, go visit websites like the Royal College of Psychiatrists to understand what psychiatry is about, how well we adhere to evidence-based practice, how holistic our model of care is. And there is a lot of different types of therapies that we do, counseling and psychotherapy, medications when necessary. Of course, we use them and use them effectively. I wouldn't want to kind of make an impression here that everybody facing lockdown is bound to get depressed or bound to be anxious. Depression and anxiety are illnesses, but some of us may actually experience depressive symptoms or anxiety states. They are not full-blown illnesses, but they still need attention. Whatever it may be, if you have a concern, just seek help. Our job as mental health professionals is to maintain confidentiality. We are trained to have good communication skills, listening skills. We allow our patients to listen so that they can address, they can air what their concerns are. All right. Self-harm tendencies can be extremely distressing, and so are suicidal ideas. Please don't keep those things to yourself. Talk to a person who you can trust. So let's go back to Siddhartha's 3 reality checks and the way forward. We have noted that old age is a risk factor, like there are other immune compromised situations. There is sickness. So what do we do when we have symptoms pointing to COVID? Think about it. What do I do? Maybe make a note or have a discussion within your family. What do we do? How do we prepare ourselves for COVID testing if we are asked to go for a test? What do we do? What preparations do we make if we have to quarantine, go for quarantine either outside or self-quarantine? What if the illness actually is causing symptoms or troubling me that I need hospitalization? What will be my role and what will be my family's role? Need to think about it. These are uncomfortable truths that we don't talk about. We need to talk about them. And what if I even end up in ICU for that matter? Please talk about these things. Please think about these things. There is nothing wrong in thinking and talking about these things. And a lot more uncomfortable thought is the thought of death. If there is one thing that is common among all of us without any discrimination. It is death. And that is reality. Now, as I earlier mentioned, 9 out of 10 are going to survive. So let us not be alarmed with the whole idea of death here. My idea is not to scare you off, but at the same time, to not talk about these things is not the right approach either. So we need to learn to face death with dignity. And in palliative medicine, and psychiatry as well, we talk about it, we deal with it, we comfort our patients. And how do we prepare as a family to bid goodbye to somebody who may be facing death? And how do you plan the last rites? Accept that we may be alone in our last days, especially with the COVID, the concern that to not allow the disease to spread to anybody else. We may be left alone in hospital bed to prevent disease spread. We need to learn to appreciate the good things in life that we had and still have. Let's learn to forgive others and myself, if possible. We should cherish the good moments and let go of regrets, gain spiritual strength. We have real challenges and we should be realistic about our solutions. Not all questions will have answers, as I have earlier said. Let's learn to live with minimum, and let's innovate ways to spend time with family. Are the kids not going to school, or is there a job loss? Let us reassure them that that loss of role is a temporary one. And we need to wait for realistic answers for a lot of these things. When does school start? Who knows? Will I get a job again? Who knows? When will I get a job? Let's find out. Let's wait. Let's do our best. We need to wait for realistic answers. And in these testing times, it is better for us to cooperate and support the government and local authorities than to kind of go against them. I'm not trying to advocate for anybody here, and I'm just talking about what is the best way forward. So who should I be? Should I be Prince Siddhartha, who was blissfully unaware of the reality? Or should I be Buddha, who should have the awareness and follow it up with action? Those who cope better in tough times are likely to be spiritually inclined. They don't depend on others for assurance of personal worth or happiness. They are minimalistic. They have minimalistic living within their means. And they understand their role towards family, society, and towards self. Perhaps this is also a time for us to reset during this calamity. Earth belongs to all. Perhaps it is an opportunity for better relations within family, an opportunity for a cleaner earth, opportunity for animals to free roam around from not restricted by the human excesses, and perhaps an opportunity for us to return to values-based living. I will end with this a little bit of fun from a village kid. It is in Telugu, but it is music, so I'm sure all will be able to appreciate beyond the language. I'll just end with this one. Let me just play this.
దేవా, ఈ కరోనా మహమ్మారి నుండి మమ్మల్ని ఎవరు రక్షించుదురు తండ్రి? ఎవరు రక్షించుదురు? ఎవ్వరూ రక్షించరు. మిమ్మల్ని మీరే రక్షించుకోవాలి. కష్టముల్ కలిగినప్పుడు కన్నీరు కార్చుట సబబు కాదు. ధైర్యముతో పోరాడవలెన్, బలముతో ఎదురించవలెన్, ఓర్పుతో నేర్పుతోను. యుద్ధముల్ చేయనవసరం లేదు, ఖడ్గముల్ పట్టనవసరం లేదు, గృహ నిర్బంధములో నుండినా అదే అదే కరోనా మీద దండయాత్ర. ఆ ఆ ఆ ఆ
Okay, thank you very much and take care.
That was very interesting, Dr. Yaru. You ended it with a beautiful poem, Padyam. Chala baagundi. Now, regarding the questions that have come, Dr. Yaru, they're saying, they're asking, how can we train the mind to accept the tough situation that has come about? How can we train our mind to accept it?
Well, it's $1 million question. I think for thousands of years, various people have worked on how effectively we can understand life and cope with the uncertainties of life. But to simply say, I think first thing is always we need to learn to be true to ourselves, and that is where the best coping strategy begins. Where we actually kind of don't trust ourselves, don't have enough confidence in our own strengths, and don't have the necessary awareness of our limitations or weaknesses, we often tend to be extremely anxious. What do the others think of me? How do I kind of present myself in front of others? So the work really has to start there. Have a good assessment with your own introspection. Sometimes meditation, such kind of things can actually help in such kind of introspection. And there is nothing wrong in getting feedback from people who you trust. Sometimes it is the family. And don't let us not always kind of put in an aspect of judgment, how they are saying so because it is them seeing me differently. We can always pick up things which are helpful for us. If there is a negative criticism, look at the merits of it. And if there is a positive constructive criticism, we need to learn to accept it and actually be reassured. This is one way we should really train ourselves to start, applying our mind in a more positive way.
Yes, correct. Chala, and the chat box lo, Doctor, many of the participants have expressed their happiness. Very informative, sir. Very practical, sir. You have given very down-to-earth information. So they're all very happy. And maybe they are trying to internalize whatever you have said, because much of what you have presented, whether it is about ikigai or whether it is about minimalistic living, it needs a lot of thought and internalization. And I hope they implement what you have suggested in order to have a peace of mind, because that is what is most important. Whether we get COVID or we don't get COVID, we need to have peace of mind so that we can live peacefully. So these were the questions, Doctor. The most important one, many people have asked the same thing. How do we train our mind? That was their question. They put it in different words, but that was a question and you answered it very well.
I think in a way I've packed one full day seminar into this 1 hour.
Yes, it was a very, yes, correct. It was a very tightly packed.
Such kind of things, yes. Such kind of things would go well in an interactive flow where we allow participants to imbibe bits and pieces of information.
And respond.
That is always very important, especially when we deal with mental health topics.
Yes, that is true. But this, the scope of the webinar could not permit something like that, because we have almost 700 to 800 registered, and interaction would have been difficult. So we had to force you to go through the format that we have designed. Thank you very much, Dr. On behalf of, thank you, thanks a lot. It gives
Thanks a lot. Thanks for having me.
It gives me great pleasure to propose a formal vote of thanks for the two-day webinar. We are hearing a lot about blended learning, which may be a recommended mode of teaching and learning in the near future against the backdrop of COVID-19. It would truly be challenging for all of us as people from the academic fraternity, because from what we hear, 71 nations do not have internet access to almost half their population as of now. And 1.2 billion children are out of school globally, according to the Indian Express dated 10th June, that is yesterday. This is a challenge that is staring at us. I'm sure that all of you will agree that these webinars have brought us, that is the teaching faculty, a bit closer and a little more comfortable with the concept of digital teaching and learning. At the outset, I would like to express my gratitude to Dr. Sister Shaiji, our principal, for her dynamic support. I am deeply indebted to all the 4 resource persons for readily agreeing to spare their time and share their expertise with us. Professor Pramila, an accomplished alumnus of our college, our well-wisher, and also a parent of an accomplished home science alumnus, Dr. Sudipta. Even though she was very busy planning her return to the US, she chose to be with us to share her views. Professor Manisha Shukul very graciously agreed to share her thoughts on quality of life in COVID times. I'm thankful to Madam Mrs. Suchitra Ella, who is an extremely busy industrialist, to have consented to be with us. Their firm is actively involved in the research for production of the vaccine, as we heard from her. In this connection, I would like to place on record my thanks to Mr. L.V. Subramaniam, IAS, former Chief Secretary, Government of Andhra Pradesh, for putting in a word with Mrs. Suchitra and facilitating her presence in our webinar. I would deem it a pleasure to thank Dr. Malladi Srinivasa Sastry, a very busy consultant psychiatrist and a committed social entrepreneur. And above all, he's almost like a son-in-law to the Home Science Department, since his better half, Mrs. Bhagavatula Gayatri, was a student of our department in the early 90s, for sparing his time and sharing his insights on alleviating COVID and general stress and also negativity in life. Thanks a lot, Dr. Garu. I would like to thank Sister Hema, our Vice Principal, Sister Mary, our Office Superintendent, Dr. Sharada, our IQAC Coordinator, for their encouragement. I would like to express a special word of appreciation for Ms. Ramani Dhanraj, former Head, Department of Office Management, and our unnamed e-learning coordinator, for all her guidance, expertise, patience, and direction. I would like to thank Mr. Srinivas, Assistant Professor, Department of Computer Science, for his technical expertise in making this webinar a reality. I would like to thank the logistics team comprising Mrs. Chandni, Ms. Lalita, and Mrs. Swarna for making it a smooth affair. I would be failing in my duty if I do not mention you all, my dear participants, all of you who have registered in such large numbers and participated enthusiastically till the end. No program would be successful without you. Finally, I would like to thank all members of my department, Mrs. Nivya, Mrs. Soni, Mrs. Alekhya, Ms. Sai Sudha, and Ms. Saumya for their wholehearted cooperation from the word go. Thank you one and all. Please stand by for the national anthem.
Clearly, don't talk, guys. Lalita garu.
जनगणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कलगङ्गा विन्ध्य हिमाचल यमुना गङ्गा उच्चल जलधितरङ्गा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Done, madam. Okay, done. LP madam, camera on change madam, sorry. Okay, done. Everything is good.